Well, the wildfire smoke we've seen over the past few weeks isn't just making the skies hazy, it's also putting people's health at risk. Our Action News reporter, Anindita Williams, shows us how doctors in Yakima are responding to the growing concerns.
This wildfire season has been one of the worst in recent years, especially in the last few weeks. Thick smoke in the air isn't just an inconvenience. For people with asthma, COPD, or other lung conditions, it can quickly become dangerous.
This has been happening for the last few years, but as you know, the main symptoms we start seeing in our chronic lung disease patients are that they come with increased shortness of breath, they start having more cough and more wheezing in some people, and then there's chest tightness, the feeling that, they're just not getting a full breath.
And it's not just those with pre-existing conditions.
Even for normal people who starts having issues because of the reactions that go on when we inhale these particulate matters, which comes from wildfire. But more so in people who have chronic lung diseases, if they are having more flare-ups, which we start seeing in our asthma and our COPD patients, then over time there is slight decline in the lung function.
The key is staying ahead of symptoms and not waiting until it gets severe.
If there is a warning for wildfires, number one thing would be to keep on monitoring the air quality index. And based on that, kind of limit all the outdoor activities. If you need to go outside, then try wearing an N95. Staying indoors would be second. And the third thing would be, stay hydrated. If you have to exercise, limit your exercise to indoors so that, outdoor activity makes us breathe more of that air, which we try to limit. Staying hydrated helps us flush the various toxins out of our system, and, eating healthy goes with anything.
While wildfire smoke continues to pose serious health risk, local providers aren't just responding, they're evolving.
I wouldn't say that we're the best and we can accommodate the most, but we are definitely getting there. And we have had lesser number of hospitalizations from wildfire-related asthma exacerbations. I think we're catching them earlier and we're able to provide for them earlier. And the same with our own lung clinic. We are trying to accommodate more urgent patients, and we have increased our own space, our number of patients we see overall, not just the wildfire season, throughout the years.
Well, thank you very much, Anissa, and more details are available on our website. And earlier tonight, we asked, has wildfire season impacted you more this year than last year? That was in today's viewer poll. Well, here are the results. The majority of voters are actually saying no, with 73% of the votes cast. Thank you to everyone who voted in today's poll, and you can read viewers' comments on our Facebook page. Keep an eye out for future polls here on KIMA Action News.